Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
It's everywhere, but not everyone's comfortable discussing it, not even with their physician. We're talking about sex, of course. Today, we'll cover everything from boosting performance in the bedroom to protecting your health. We'll also uncover the real science behind pleasure, pain, and protection, as well as answer your questions on this episode of Ask the Doc, No Appointment Needed. Welcome to Ask the Doc, the show where we encourage viewers to send in their health questions. I'm Dr. Lia Jiannine, sexual health expert and associate professor of health and human performance at Nova Southeastern University. Let's kick things off with a Facebook question from Joaquin, who asked, does having a lot of sex reduce my risk of getting prostate cancer or an enlarged large prostate? Well, that's a good question. Prostate cancer is the most common cancer among men, but it can often be treated successfully. There are different risk factors involved with who will develop the cancer, including age, family history, obesity, and diet. So it's important for men to do what they can to reduce those risks. As for whether or not frequent sex will help, the answer is possibly. Some studies have found that men who ejaculate more frequently may have a lower risk of prostate cancer, regardless of whether or not they ejaculate through masturbation, sex, or nocturnal emissions. One large study showed that men who ejaculated 21 times or more a month had significantly lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times a month. The theory is that frequent ejaculation may help flush out harmful substances from the prostate and reduce inflammation or the buildup of carcinogens. There is less clear evidence about whether frequent ejaculation can help with a large prostate, which is common with aging. Some small studies suggest that sexual activity may help reduce urinary symptoms, but it's not a proven preventative measure. So having frequent sex or ejaculation is likely to help prostate health and reduce the risk of prostate cancer, but it's not guaranteed. If you're concerned or have any worrying symptoms, please go see your doctor. Our next question comes to us from Phoebe, who reached out to us on our YouTube page. At a recent girls' night out, all of my girlfriends were talking about Scream Cream and how great it is during sex. Is it as good as they say, and do you need a prescription for it? Well, thanks for that very topical question. Scream Cream is a name for popular types of topical gel or cream to enhance sexual pleasure for women. It works in part by increasing sensitivity, arousal, and lubrication. One type usually contains the ingredients L-arginine, which boosts blood flow, menthol, or capsaicin, the ingredient that produces a tingling or warming sensation. It's available over the counter in many places, and it's only to be used externally. Many women who have it have reported heightened sensations, increased arousal, and more intense orgasms. The effects vary depending on the person's sensitivity, the specific formula, and the concentration of the ingredients and how it is applied. Some women may experience immediate results while others notice a gradual improvement over time. Most women say that they have felt like it could take effect within 20 or 30 minutes after applying the cream, but the effects can last for hours. Another cream that is considered a scream cream contains topical sildenafil, which is the generic form of Viagra. It can also increase pleasure and arousal for women. One study looked at the effects of topical sildenafil on women ages 25 to 55 who didn't have sexual dysfunction after watching a sexually explicit cream. Those who used the cream experienced a significant increase in arousal compared to those who didn't. One recent large study found that it can strengthen orgasms after just 8 weeks. Another study suggested that it can reduce anxiety or frustration around sex. But so far, these studies looked at women before and during perimenopause. The effects on postmenopausal women haven't been studied yet. Topical creams are generally considered safe for women to use. Most are made of FDA-approved ingredients, but you want to make sure you're using it as directed and don't use unbroken skin. If you experience any discomfort or irritation, discontinue using the cream. If you have any underlying medical conditions or taking medications, definitely consult with your doctor. Logan reached out to us on our YouTube page, and his question for me is this. I'm a 25-year-old uncircumcised man. I'm thinking about getting circumcised mainly because some of my reactions I've gotten from my sexual partners. Are there any health advantages about getting circumcised at my age? And besides looks, what are the advantages? Hi, Logan. As with any surgical procedure, there's a risk when you go under the knife, but there's a lot of research about circumcision in adults. As with any operation, there are some risks similar to other minor surgeries like infection, bleeding, and swelling. Complications are uncommon, and it's generally considered safe to get circumcised as an adult. If you have the operation, you'll need 4 to 6 weeks to recover, and you need to make sure you avoid sexual activity during that time. Just make sure you have it done by an experienced urologist or surgeon. There are advantages in addition to looks, such as improved hygiene. Your penis is easier to clean without the foreskin. This can help reduce the risk of smegma, which is a naturally occurring substance made up of skin cells, oils, and moisture. It can also help reduce the risk of infection from the buildup, and it can lower the risk of other types of infections, including urinary tract infections, sexually transmitted diseases, and rarely penile cancer. As far as sex goes, many men report no loss of sexual function from getting circumcised. Sensitivity changes vary from person to person, and they're subtle. If you decide to go ahead and get circumcised, here are a couple of things to keep in mind. Talk to your urologist and make sure that you understand what the procedure involves. And before you decide, balance the social and some partners' reactions with the health benefits and risks. Savannah sent in this question via our very own website at allhealthtv.com. I have young children, and I've been told about the HPV vaccine. Is it just for sexually active kids or for all kids? Well, thanks for your question, and I commend you for being so proactive about your children's health. It's best if the HPV vaccine is given before children become sexually active. The CDC suggests that both boys and girls get vaccinated starting at age 11 or 12, but the vaccine can be given to children as young as 9. The reason behind vaccinating children so early is it gives the immune system time to build up protections ahead of exposure. While initially those over 27 could not get vaccinated, adults up to 45 can now receive the vaccine. If you're wondering why it's so important to vaccinate children, it's because of what exactly HPV is, because it can cause some serious diseases and conditions. HPV stands for human papillomavirus, which is a common sexually transmitted infection by a group of viruses that can infect the skin and mucous membranes. The virus is spread through direct skin-to-skin contact, commonly occurring during sexual activity. The CDC estimates that each year HPV causes about 36,000 cases of cancer in both men and women. So HPV is not just a women's health issue. Men are at risk of developing serious diseases too. Some HPV strains can cause genital warts in men, which are contagious, and HPV is linked to cervical cancer, penile cancer, anal cancer, and throat cancer. HPV is recognized as the leading cause of throat cancer in developed countries, and throat cancers have been on the rise, particularly in men under 60. The vaccine treats new infections of HPV, but does not treat existing HPV infections or diseases. And even with the vaccine, it's important to stay up with continued screening like pap smears. And the vaccine is considered very safe and effective. The common side effects include a little bit of soreness at injection site, mild fever, and headache. Next up, we have another question from allhealthtv.com. You really should check out our website. It's chock full of a lot of great information. So, Valencia asks, my partner has been acting very unusually while he's asleep. The other night he tried to have sex with me, but when I woke him up, he didn't remember doing it. Is this serious and should I talk to someone about it? Hi, Valencia. I can imagine that this would be unsettling and difficult to talk about. So thanks so much for sharing your question with us. Your partner sounds like he may have a condition called sexsomnia or sleep sex. It's a fairly rare sleep disorder where a person engages in sexual behavior, either getting erections, masturbating, or trying to engage in sex while asleep. It's often linked to sleep deprivation, stress, or anxiety. It's also linked to sleep disorders, alcohol, or any types of medication use that can affect sleep patterns. A person who has sexsomnia can appear to be awake and to others, but they may have no memory of their actions. One study by the American Academy of Sleep Medicine found that men were 3 times as likely to suffer from sleep somnia than women. It can be especially serious because it can lead to embarrassment, confusion, or relationship strain. It could also lead to non-consensual sexual activity, which almost happened in your case. There are treatments for it. Some include lifestyle changes like improved sleep hygiene, stress management, and cutting back on alcohol. There are also medications and psychological therapies such as cognitive behavioral therapy. Your partner should consider getting a sleep evaluation so that they can define the diagnosis and check for other sleep disorders. In the meantime, they should avoid alcohol, sedatives, or anything else of that nature before bed. You might want to set boundaries such as separate sleeping arrangements. The next YouTube question comes from us from Maddox. He asks, how did GLP-1s increase your sex drive? Hi, Maddox. Thanks for sharing your question for us. Wouldn't it be amazing if they developed a medicine that could not only boost your libido, but also help you shed pounds at the same time? Well, GLP-1s are a hormone that regulate blood sugar levels. GLP-1 agonists are a class of medications for people with type 2 diabetes. They lower blood glucose by increasing insulin secretion. Some are approved for chronic weight loss management, like Wegovy and Trulicity. These type reduce appetite and slow stomach emptying, which can lead to feeling fuller. Some of these medications can also reduce the risk of major cardiovascular events like heart attacks and strokes in people with diabetes. There is no clear evidence or scientific research that GLP-1 medications directly increase your sex drive. However, some people might experience an increase due to a boost in self-esteem because of the weight loss or improved nerve and vascular health, resulting from better blood sugar control. One study cited the role of insulin control in influencing sexual hormones like testosterone that could help increase sex drive. As with many drugs, GLP-1s have side effects, and you should be aware of them. The common ones are nausea, vomiting, diarrhea, and abdominal pain. There are also rare risks like getting thyroid disorders. As with any medication, you should discuss it fully with your doctor. Antonio sent us another YouTube question. My girlfriend is very small and tight in her private area, and sometimes that makes sex difficult for me and painful for her. Is there anything that we can do to make things easier for us? Well, thank you so much for your question, Antonio. Every woman's vagina is different, so there could be different answers as to why your girlfriend's vagina feels tight. Maybe she's not aroused enough, so she might not have enough lubrication, which can cause friction and pain. Certain medications can cause dryness that could also make her vagina feel tight, including antihistamines, antidepressants, or anti-estrogen meds. If she feels anxious or stressed, it could also make her pelvic muscles tight. There are some medical issues like infections that could also be the cause. So here are some things to try. Focus more on foreplay. Take time kissing, touching, and arousing her. Ask her to tell you what feels good and then do it. Go slow and be gentle. Make sure the environment is relaxing enough to help her reduce anxiety. She may be feeling intense, so you want to do everything you can to kind of ease that. Try using a water or silicone-based lubricant. They can be used internally and reduce friction and discomfort. Try some positions that allow her to control the depth and the speed. Maybe having the woman on top or side by side and spooning. She could also do pelvic floor exercises that strengthen the muscles, which may sound counterintuitive, but these also help with control and relaxation. You could even try doing them with her. You could try some or all of these things. And if the pain persists, then she should see a gynecologist to rule out any infections, hormonal issues, or vaginismus. Our next question comes to us from Lauren, who reached out via Facebook. Lauren wants to know, my husband says he wants to try some new things in the bedroom. He doesn't say he's bored with sex after over a decade of marriage, but that's kind of the implication. What are some ways we can bring excitement to the lovemaking, but in monogamous ways? Well, hi, Lauren. Thanks for being brave enough to reach out with your question. And I love that you're advocating for yourself. Sex between two committed people should never be boring, and you don't have to step outside your relationship to find excitement. To start, find a time when you're both not stressed or tired and have a conversation with him about what is lacking in your sex life. Don't be defensive or feel hurt, and tell him how you feel. Do you have one or two positions that you've always wanted to use? Maybe it's time to try some new ones. There are plenty of examples on the internet, and you both can look at them together to see which ones you want to try. Or you could take turns picking out which position you want to do next. Use pillows or another piece of furniture instead of the bed. Leave a sexy note for him near his morning cup of coffee, telling him how much you're looking forward to that night and describe what you'd like for him to do. Or text him during the day a flirty message. Be sure to make sure those messages are sensual and about connection to each other. You could try using sensory play, like gently running a silk scarf over his skin, maybe even blindfold him. That will heighten his other senses. And don't forget about sex toys. There are so many out there, like vibrators, couples rings, or massage wands that can add a new sensation, and you can pick them out together. Have you ever thought about giving him a slow, sensual full body massage? Light a candle and use scented oils to get in the mood. Afterwards, suggest maybe he does that for you next time. Share your fantasies with him and make him share his. Then act them out safely or try role playing. Keep it lighthearted and get some boundaries before you start. What about exploring mutual masturbation? You could watch each other or stimulate yourself while you're lying side by side. Share with him what it feels like and ask him to do the same. If he can help you build intimacy and understanding without pressure, that would be best. Always remember the goal is to focus on pleasure, not performance. And you want to communicate with each other about what's working and what isn't. And there's no timeline about how much you need to change. Try new things slowly and keep the communication open and flowing in both ways. This next question comes to us from Clarissa, who reached out to us on our allhealthtv.com. Clarissa asks, recently I've been having trouble getting aroused and having an orgasm. At first, I thought it might be my current partner, but I've had this problem with other partners too. Is this problem physical or mental? Well, Clarissa, thank you for your question. Your problem could have its roots in either or both physical and mental causes. Let's look at the physical first. Some medications, such as antidepressants, blood pressure meds, or hormonal treatments, could be the problem. They can reduce your ability to orgasm. A low estrogen level can also affect your sexual response. Diseases like diabetes, multiple sclerosis, or nerve injuries can also impact your sensation and leave you unable to orgasm through intercourse. So can thyroid issues or other chronic diseases. Then, of course, there's pelvic floor dysfunction, muscle tension, weakness, and all of these can affect your ability to orgasm. Fatigue can also be a big factor. There are a few emotional and mental causes. Anxiety or stress due to performance or your relationship can block your ability to have an orgasm. If you've had any past trauma or negative sexual experiences, they can stop you from being in the moment and also prevent you from having orgasms. Do you feel a lack of emotional connection with your partner? Any unresolved conflict? Any of these can also play an effect. And speaking of minds, if your mind is not in the right place, then that could certainly make a difference during partnered sex. And if you've got some body image issues or self-esteem concerns, it may be harder for you to climax with your partner. Or it could be that you feel more fully in control if the timing, stimulation, and comfort when you masturbate. You could feel less pressure to climax, or there's less distraction when you're alone. And you might feel like you're in a safer, more relaxed state when you're alone too. There are a few things to consider about why you're having this problem. Have you changed your medications lately? Are you under any more stress or had any health changes? If you answer no to those questions, you might try experimenting with your partner while you both masturbate. That mimics the experience while you're both alone. Also consider speaking with a healthcare provider for a physical checkup to make sure you're healthy. And if you feel like it's a mental issue or relationship problem, then definitely look into seeing a sex therapist or a counselor. This next question comes to us from Jordan, who reached out to us via our YouTube page. Jordan wants to know, hi, Dr. Lia. I'm dating a new man and I'm really crazy about him. My concern is that he's HIV positive. He says that he takes medication to control it and his viral load is undetectable, so he really can't spread the disease to me. But I'm skeptical. What can I do to protect myself? Well, hi, Jordan. Thank you so much for sharing this very relevant question with us today. This could help a lot of other viewers. It's good that he was open with you about this and that you're willing to support him. Now let's talk about how to protect yourself. First, ask your doctor for PrEP. It's a daily pill that can prevent HIV exposure and it's highly effective. It works by blocking HIV from replicating the cells and preventing the virus from establishing infection. There's also long-acting PrEP, which is injected every few months if you don't think you could take the daily pill. Remember, PrEP won't protect you from sexually transmitted infections and does require you to be tested before and during. You must also have regular follow-ups with your healthcare provider. If you're dating other men besides this one, it would be a good idea to take a look into PrEP just in case. There is also PEP, or post-exposure prophylaxis. This is a medication that's taken after potential exposure. It's typically taken within 72 hours of exposure and taken for the next 28 days. It can greatly reduce the risk if taken quickly and if you follow up over the course of the next 28 days. You can get in the emergency rooms or even from your healthcare provider. If you don't want to do any of these things, there's always condoms. If used correctly, they're highly effective. Part of supporting the man you're dating is to have an open and honest discussion with him. Let him know what you are going to do about protecting yourself and suggest that he do the same if he hasn't already. Also, you are right to ask him to tell you if he's seeing somebody else, especially someone that's HIV positive, and ask what they are doing to help them from preventing spreading HIV virus. Well, that's it for the episode of Ask the Doc. Thanks for watching. We'll see you next time.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.